Looking tired and older because of under-eye bags is one of the most common issues we see in our practice. Patients have told me how frustrated they are by people asking them all the time if they got enough sleep or if they're upset or angry about something because of the bags under their eyes. What causes these bags to occur? Puffy under-eye bags are caused by fat normally around the eyes called orbital fat, which prolapses forward like a hernia. In fact, we refer to these bags as herniated fat. Lower eyelid fat prolapse tends to be caused by genetics and can be seen in men and women in their 20s and younger. Oftentimes, these under-eye bags, which can appear to be excess fat, coexists with hollowness or bone deficiency under the eyes. Once again, this bone deficiency is also a genetic trait. Puffy bags can appear or progressively get worse with aging as the support structures around the eyes get weaker and bone loss under the eyes diminishes with age. The generally recommended treatment for under-eye bags is a surgical procedure called lower eyelid blepharoplasty. Conventional lower eyelid blepharoplasty for under-eye bags is performed through an incision in the lower eyelid skin below the eyelashes. This external approach is conventionally practiced by plastic surgeons to access the fat pockets under the eyes and to remove skin with the intention of improving fine lines and wrinkles. Although this incision can heal well, skin types such as olive or Mediterranean skin, South American, Middle Eastern, South Asian, and people of African origin are at greater risk to have hyperpigmentation and keloid or raised visible scars. This approach can also compromise the anatomic structures that are critical for your lower eyelid support, resulting in the eyes being pulled downward or rounded, which causes exposure of the white part of the eye called the sclera. This results in a change of the characteristic shape of your eyes. The psychological impact of having the shape of your eyes changed in a way you don't want cannot be overstated. Over 30 years ago, I questioned the justification of making this external incision and came to the conclusion that an alternative approach where this outside skin incision is avoided and is preferable for people at risk of undesirable pigmentation, keloids, and visible scars. I recognize the need to customize eyelid procedures for under-eye bags for a range of skin types and unique anatomic bone and soft tissue characteristics of people from all ethnic backgrounds. I developed my own modifications of conventional procedures and published an article in the 90s titled Ethnic Considerations in Eyelid Surgery, one of the first articles of its kind. Having an ophthalmology and oculoplastic background, I have training and experience working in areas close to the eyes that is more specialized and in-depth than the common residency training of general plastic surgeons. I realized that I can preserve the muscles, support structures, and the characteristic shape of the eyes by accessing the fat from the inside of the eyelids. In my practice, I routinely perform lower eyelid blepharoplasty from the inside of the eyelids. This technique is called transconjunctival blepharoplasty. This approach I use is a technically advanced, as I stated earlier, it allows me to preserve the unique characteristic shape of your eyes. Additionally, I routinely use platelet-rich plasma, or PRP, or platelet-rich fibrin, or PRF, to stimulate collagen production and new blood vessel formation, which is very effective in improving the appearance of fine lines, wrinkles, and dark under-eye circles. Our patients regularly speak about how relieved and delighted they are not to have bags under their eyes. They often say to me, "How did you do this?" Since they can't see how I was able to do the procedure without any obvious incisions. They're also surprised to experience minimal or no discomfort afterwards. I should also mention that I have been well aware of concerns people have about the risks of general anesthesia, where a breathing tube is placed in your throat and you're on a respirator. General anesthesia is often associated with nausea, vomiting, and extended or prolonged recovery. I questioned this anesthesia choice over 30 years ago, since in ophthalmology we performed surgery inside the eye, such as cataract surgery, under local anesthesia. I proved that all types of eyelid surgery can be performed under local anesthesia with or without light IV sedation, thus reducing anesthesia-related health risk and improving recovery time. I also recognized how people undergoing cosmetic procedures are very uncomfortable in a cold hospital-style operating room environment, particularly with staff who may be caring but are not dedicated to only one surgeon and the procedural preferences of that surgeon. I built hospital-level facilities in my offices and have dedicated staff who work with me every day. They know my patients, and my patients appreciate being cared for by medical staff they met during consultation and see them at surgery as well as follow-up visits. My patients typically return to work in 1 week with minimal bruising or swelling. I often hear my patients tell me that if they knew that the procedure was that easy, they would have done it sooner. If you're concerned about under-eye bags and the issues I discussed, I invite you to contact my office and speak to my staff, who will be happy to provide you with information and insights about how we help people with under-eye bags.